theories of retention. जो theories हैं retention की, there are 9 theories given by Riddle and 10 theorem added by Moyers. The theorem 1 actually states the teeth that have moved tend to return to their former position. The teeth tend to go back to their original position after the orthodontic treatment. So, once again, the thing is that the teeth have moved, to their return to their former position, and the teeth tend to go back to their original position after the orthodontic treatment. Okay. Theorem 2, elimination of the cause of malocclusion will prevent relapse. Malocclusion should be identified during the diagnosis and possible steps. So, elimination of the cause of malocclusion will prevent relapse. Okay. And malocclusion should be identified during diagnosis and possible steps. Okay, I mean to say कि जो possible steps हैं that should be taken to eliminate the cause of malocclusion, because the failure to remove the cause increases the relapse potential. This theorem can be applied in cases of malocclusion where the cause is obvious due to thumb sucking, tongue thrusting, etc., and not in any cases of malocclusion where the cause is elusive. तो मुझे आपको समझाना था एक और बार कि failure to remove the cause increases the relapse. मतलब the thing is that failure to remove the cause, so relapse potential increases. So this theorem is applied in cases of malocclusion where the causes where the cause is obvious due to due to thumb sucking, tongue thrusting, and not in any cases of malocclusion where the cause is elusive. Okay. Now theorem 3. Malocclusion should be corrected by a safety factor. Orthodontists recommend overcorrection so as to give leeway for a certain amount of relapse treatment of class 2 or class 3 malocclusion. So the thing is that malocclusion should be overcorrected as a safety factor. Orthodontists recommend overcorrection so as to give leeway for a certain amount of relapse. The treatment of class 2 and class 3 malocclusion. So मेरे कहने का मतलब ये है कि लीवे स्पेस बहुत इंपॉर्टेंट है. सो द ऑर्थोडोंटिस्ट एक्चुअली शुड रिकमेंड ओवर करेक्शन सो एज टू गिव अ लीवे फॉर सर्टेन अमाउंट ऑफ रीलैप्स. ठीक है ना. थ्योरम 4 में क्या होता है? थ्योरम 4 में ये होता है कि प्रॉपर ऑक्लूजन इज़ अ पोटेंट फैक्टर इन होल्डिंग टीथ इन देयर करेक्टेड पोजिशन. सो थ्योरम 4 इज़ वेरी ईजी. द थ्योरम 4 सबसे ईजी है, ज़्यादा कोई कन्फ्यूज़ होने की बात नहीं है. और द थिंग इज़ दैट कि occlusion should be proper. It's a potent factor in holding the teeth in their corrected positions. Now, post-treatment stability is increased by good occlusion. Okay, theorem 5. Bone and adjacent tissues must be allowed time to reorganize around newly positioned teeth. When the teeth are moved orthodontically, numerous changes occur in the bone. So this is the thing. This is the theorem 5 जो state करता है कि जो bone है और जी adjacent tissues हैं, they must be allowed time to reorganize around the newly positioned teeth. So when the teeth are moved orthodontically, so numerous changes occur in the bone. Okay, of course, orthodontic treatment तो bone changes तो होगा, इसमें कोई ऐसी बात नहीं है. Of course, the bone changes will occur, and surrounding tissues also. The next is that कि जो new osteoid bone is formed around the recently moved teeth offers inadequate retention. So new osteoid bone that is formed around around recently moved teeth, first inadequate retention. Now, theorem number 6. The theorem 6 is that if the lower incisors are placed upright over the basal bone, they are more likely to remain in a good alignment. So, this is the theorem 6 की है कि जो lower incisors हैं वो placed होते हैं upright over the basal bone, they are more likely to remain in good alignment. So most stable results are obtained by placing the mandibular incisors. ठीक है, stable results जो होते हैं they are obtained by placing the mandibular incisors. So this is the over the basal bone. So the orthodontist should aim at positioning the lower incisors perpendicular to the mandibular plane or even retroclined. So orthodontist को क्या करना चाहिए कि they should aim at positioning the lower incisors perpendicular to the mandibular plane or even retroclined. ठीक है, तो orthodontist को should aim means they should position the lower incisors perpendicular to the mandibular plane. Okay. Theorem 8. Corrections carried during the period of growth are less likely to relapse. So the corrections carried during the periods of growth are less likely to relapse. So early treatment procedures involving growth modulation aimed at intercepting skeletal malrelations prevent full-fledged malrelations and compensation from occurring. So this is the thing कि जो early treatment होता है, procedures involving the growth modulation aimed at intercepting skeletal malrelations, they prevent full-fledged malrelations and compensation from occurring. Now theorem 8. The farther the teeth have moved, the lesser the risk of relapse. The farther a tooth has been moved, the lesser is the risk of returning to its original position. So it is desirable to guide the erupting teeth to intercept failure malocclusion. So the thing is कि जो farther the teeth have moved, the lesser is the risk of relapse. So the farther a tooth has moved to been moved, the lesser is the risk of it returning to its original position. It is desirable to guide the erupting teeth to intercept future malocclusion. Okay, so farther tooth has been moved, so there is lesser risk of returning to its original position, and it is desirable to guide the erupting teeth to intercept future malocclusions. So future malocclusion can be intercepted if you know it is desirable to guide. Okay, so teeth should be guided. Okay, the farther the teeth have been moved, the lesser is the risk of relapse. So distance should be there, far. Okay. Now the theorem number 9. Theorem 9, you have the arch form, particularly in the mandibular arch, cannot be permanently altered by appliance therapy. So the thing is that कि जो arch form होता है, तो in the mandibular arch cannot be permanently altered by appliance therapy. So alteration of existing arch forms results in increased risk of relapse. मेरे कहने का मतलब ये है कि arch form, particularly in the mandibular arch, ये जो arch form है, mandibular arch cannot be permanently altered by appliance therapy. So alteration of existing arch forms results in increased risk of relapse. So ये है कि arch form है, particularly in the mandibular arch, cannot be permanently altered by appliance therapy. So altered नहीं होता है appliance से, तो arch form जो है ना mandibular arch, alteration of existing arch forms increased risk of relapse. ये सब है. According to Macaulay, the mandibular, intercanine and intermolar widths are uncompromising, so thus they should be considered as fixed landmarks and the rest of the arch is built around them. So the thing is that कि जो Macaulay है उस क्या बोलता है कि जो mandibular, intercanine और जो intermolar widths होते हैं तो uncompromising होते हैं और they should be considered as fixed landmarks and the rest of arch is built around them. So this is the thing. Okay, so जो है कि अनकॉम्प्रोमाइजिंग हैं, जो इंटरकैनाइन और इंटरमोलर जो विड्स हैं, they're totally uncompromising, so they should be considered as fixed landmarks and the rest of arch is built around them. So landmarks कौन-कौन से होते हैं? Intercanine or intermolar widths. They are considered as the the landmarks. ठीक. Now the theorem 10 that is added by Moyers. Many treated malocclusions require permanent retaining devices. Certain malocclusions require the patients to be fitted with a permanent retaining device. Many treated malocclusions require permanent retaining devices. Certain malocclusions require the patient to be fitted with a permanent retaining device. So treated जो malocclusions होते हैं, they require permanent retaining devices. Okay, of course, malocclusion treat करने के लिए retaining devices का होना बहुत ज़रूरी है, और malocclusions required the patient to be fitted with a permanent retaining device. So theorem 10 is very interesting. I mean to say very easy कि of course malocclusion जो treated होता है तो permanently retaining devices तो होने चाहिए, because उसी से आपका जो malocclusion treat हो सकता है.